So we're here for a train-the-trainer event today. The last 2 days we were here for the responder readiness and then also the supervisor readiness. So today is just, it ties it all together. 20 years ago when we talked about mental health, there's a stigma that's related to mental health. People were afraid to ask for help, or they didn't know where to get resources. So I think in this generation, or fast forward 20 years, I'm an instructor for Gateway in this topic, officer wellness, suicide prevention. And I think it's important to change the culture of our profession, to give young officers, old officers, the ability to have those resources at their fingertips, right? To be able to engage one another, to ask the tough questions, or have courageous conversations with each other about the difficulties of this profession. The things that just build up, well, that's our stress, right? It starts off, when you're on the road with a typical traffic accident, then you get a fatal accident, then you have to go to homicide, then you lose a colleague, and it just keeps compounding. And if you don't have the resources, it could ultimately be, a bad situation for that officer where they may contemplate suicide. You can have an employee who comes to work and they're squared away every day. Now they become, disheveled. They're not showering. Their uniform's not kept up. Maybe they come smelling of alcohol. So our plan is to train all of our peer support team, including building our peer support team into a larger support network for our people. Making sure all of our supervisors understand what the dynamics of this is and have that same buy-in, the same philosophy that our officer wellness is our #1 priority right now.